Hi everyone, we're going to talk about some hematology issues that you may see in primary care. This does not correlate with the book. The information is in the book, but this is a PowerPoint that I set up and presented a couple of times to different organizations in the local coalition region. So I thought it would have some applicable information that you might be able to apply. So we're going to talk about some common hematological abnormalities and conditions that may be seen in primary care. We're going to look at these abnormalities and what you might see in screening labs, and then discuss different conditions, treatments, and if you had to refer someone to a hematology office, what you might be able to educate your patient on. So some of the common conditions that you might see in primary care and hematology include your anemias, which for the purpose of our conversation is going to be iron deficiency and vitamin B12 deficiencies, myeloproliferative disorders, that would include polycythemia vera and iron overload, leukocyte disorders, and platelet disorders. As a registered nurse, I know I had a basic understanding of different blood cells, the CBC. That knowledge increased when I became a nurse practitioner, but I really don't know if I understood or figured out all the nuances that go on with CBCs. So I've learned a lot, and especially since I practice now in hematology oncology, so I wanted to give you guys a little bit of that information. So we're going to go over an overview of some things that you know about hematology. We'll first talk a little bit about the red cells. We know that red cells help tissues and organs get the oxygen and nutrients that they need to survive. The blood vessels and the blood carry these nutrients through to the organs. These vessels include arteries, veins, and capillaries, and red cells provide oxygen and are the fluid part of the blood that carries nutrients, and also the blood carries waste away from our tissues. What you may not know is that there are over 100,000 miles of vessels in the adult body, which I think is fascinating. We talked briefly about white cells being involved in transporting waste, but it also protects the body from infection as well as it fights infection. We know that blood is comprised of various cells that circulate in the protein in the plasma, and the adult volume is approximately 6 quarts, or approximately 5.5 liters. So we're going to review a little bit about blood composition, and you may think that this is very basic, but I think it's important to review. I review this with patients every single office visit, because that's what my practice is based on, is looking at labs, primarily in CBCs and other labs. So I want us to understand the basics here. Whole blood is primarily made up of 4 cells. That includes our red cells, which are hemoglobin and hematocrit, our white cells, which are made up of 5 different cells, the neutrophils, the eosinophils, basophils, lymphocytes, and monocytes, and then our platelets. So we're going to talk about each of those here briefly. The red cells, which are also called erythrocytes, are the most abundant cell in the blood. The life expectancy is anywhere from 90 to 120 days. Depending on your reference lab, a hemoglobin for a female is anywhere from 12 to 16, and for men, anywhere from 14 to 18.